Hi, I'm Dr. Srinivasa. I'm a double board certified plastic surgeon and the chief surgeon at the Institute for Advanced Breast Reconstruction, and I'm here to answer all of your questions about breast radiation and breast reconstruction. Radiation is where they basically use beams to treat the skin and the tissue to try and kill any maybe leftover cells. So when you have a lumpectomy, almost always you're going to need radiation. When you have a mastectomy, oftentimes you can avoid radiation, but in some instances, if the tumor was large enough or the number of lymph nodes were involved is greater than a certain threshold, they'll do post-mastectomy radiation therapy. So that's why it's really, really, really important. If you are a patient and you know that you're gonna get radiation, you need to talk to a board-certified, fellowship-trained microsurgeon, because breast flap reconstruction using free flaps is definitely the superior option. So the most common iteration of this is a DIEP flap, or DIEP. And the acronyms for all these flaps, they're just names of blood vessels. The pitfall here that patients fall into is that a lot of surgeons say they do a DIEP flap, but they're not really doing a true DIEP flap. They're doing a tram flap, or a variation of that operation, a muscle sparing tram. What you don't want is someone de-innervating or cutting a big part of your muscle, because there's functional deficits that come with that. And there's also aesthetic complications. And it's really important that when you see a surgeon, when they say they're gonna do a DIEP flap, they're actually gonna do a DIEP flap. I always tell patients, ask them how many they do a week. If they respond with how many they do a month or a year, probably you could find someone who does this a little bit more. So what I do, because I do a lot of this, is if a patient chooses to have the DIEP flap up front, I accommodate for that. I can promise a very thoughtful and insightful approach to your reconstruction. I would be happy to see you at the Institute for Advanced Breast Reconstruction. I do virtual visits, I do in-person visits, second opinions, third opinions. What's important to me is that the patient gets accurate information and they have someone they can talk to for all of their questions.